would ask you, lay people, non-doctors, which one of the parents looks sick to you? Yeah, it looks like the father. And again, it's not rocket science. And so I said, as doctors do, take off your shirt. And he did. And then this is months after this guy is walking in and out of the ward to see his son. And of course, I guess one of the points I make is we don't have the diagnostics, and these delays cause problems. They cause people to die, of course, but they also cause, as David mentioned, ongoing transmission of tuberculosis, including in hospitals, which is a huge problem globally. And then for those interested in the clinical part of it, so this is just a digital photo of his X-ray. All right. So there you have it, for those of you interested in such matters. Obviously, as everyone at every table knows, this is an obvious and a whopping case of pulmonary TB, and that's the father who's been coughing in this miserable little place, this hut, and he has a whole bunch of children. About half of them, we thought, had active tuberculosis. Now, the good news, just to end up, is so what do you do then? And this is a big struggle for everybody in global health. And I don't want SBRI to start worrying about housing conditions in Haiti. I want everybody in the labs to stay in the labs. Don't come out. The people in this room have helped build you good labs. Stay in there and get us the vaccines and medicines and diagnostics. And we, on the outside, are waiting for those tools. We're waiting to have the things we need to deliver. But people of Seattle, you should be very proud of what has happened in this city. And some years ago, I was here. I think it was maybe even the talk that Joe mentioned. I was at the foundation. By the way, that's what we call it outside of Seattle also. The foundation. It's like the CIA being called the firm. I think it was that. I think it was on that visit, and there was some newspaper articles, and I was saying, look, I think Seattle is going to become the hub of global health in this country and the world, and I hope. I hope that what Ken has been calling the community, that is the people of Seattle, from the business community, from the foundations, from the universities, are proud that this city has helped to put global health on the map, and are proud of the fact that if you look at the late 20th century, which is when I trained in medicine, and many of the people who are senior researchers now trained, this city and a number of institutions based here really performed, as I put it this morning, and Ken said you're allowed to say that time, performed CPR on international health. This was not a field that was growing. It was not drawing young people. It was not drawing students. It was really a hangdog kind of depressed field. And you can't rebuild something without investing in it. And I just think that here, in this city, people have been thinking about discovery from basic science, about developing new products, and really also about delivering the services. And that's what we need to do. Right? Too often in a research university, and I won't mention anyone by name, but I worked with one of them, there's a focus on research and training, but the service part gets too slender. And it doesn't matter who is doing the service part. It just matters that it be done. And that's what I think we can build together when we have the right kind of investments in basic research, getting the tools that we need to take care of the people we're serving. We'll find ways of delivering them that are acceptable to the people we serve and also impressive to those who would support this work. I think that we are on a path towards real progress in global health, not just in building a field of global health, but in actually reversing a lot of what were called emerging epidemics today, and in building on to think again about Rotary and building on the successes of some of the more specific programs. That's where I think we're headed. And as you can imagine, there are a lot of people waiting. And that's my last image, is from a beautiful brand new hospital we just built in Haiti. And a lot of people there are waiting.